it's close enough to 8:30.
Misty, this is okay.
Okay, Misty, we had put you on the agenda earlier this week because I had noticed that the lawn and stuff out at the EMS building wasn't looking very good. But we ended up getting a letter from the city here about weeds and keeping up the yard. We just wanted to talk to you about it and see kind of what we needed to do as far as, I noticed that the lawn has gotten mowed, but there's still some weeds that are, 6, 7 foot tall, and some trees growing up the side of the building. What do you think would be the best course of action to remediate our problem?
Nicholas Houston was actually doing our lawn work, but he is on quarantine for a couple of weeks now, so.
Yeah.
But one of us could pick it up too. I mean, I'm sorry, we've just been really busy around ambulance calls that we've only had one day where we haven't had an ambulance call.
Yeah.
So, but I'll keep up on that, and I'm sorry. I didn't realize we got a letter.
Yeah, well, we had planned on talking about it. The letter just
The letter
came
came
yesterday. But there's some weeds and stuff, around the tornado shelter that are, bigweeds that are 6, 7 foot tall, and then up against the fence. We just want to make sure we're taking pride in, it's on a busy street, and make sure we're taking pride in our appearance, I guess.
Yeah, there's 2 trees there, one growing by the antenna and one down the building a ways. They're probably 7, 8 foot tall.
Okay.
So, if you have trouble getting the trees killed, maybe you can get Ryan to come in there and put something on them.
Okay.
I don't know. We're looking at doing something different with the courthouse yard. If you guys don't want to do that, do you want us to have the people look it out there when they look at this and give us a bid
Sure.
on doing it? If you guys are busy and you don't want to do it, it maybe just be one
It'd
less
be
thing on
beneficial,
your.
if to have somebody doing everything, that would take it off of us, but if we needed to do it.
Yeah.
we
Well, I'm
would.
sure you're busy enough.
Well, I think,
We are right now.
I think it'd be fair if whoever's doing the courthouse do the EMS.
Okay.
Okay.
Do you guys have sprinkler systems out there? You know?
I don't think so.
Things.
Okay.
And then I guess we might just need to visit with Ryan and make sure that he's spraying the parking lot. And if he would spray around like that tornado, you can't mow up next to that tornado shelter because the fence is right next to it.
Yeah.
And there's just weeds growing up in there. And aside from pulling them or hoeing them out or weed eating them, it probably needs to be just ground sterilized once or twice a year, and to where weeds doesn't grow around there. But I had noticed it, I wanted to talk about it, and then, the letter came later, but, so.
I would say that probably instead of trying to have Ryan do that, because he's busy, probably ought to get somebody like Pookie
Yeah.
and tell
Yeah,
him this is, I don't know what this really is.
Like you said.
I don't know
Jaron Truitt.
Jaren's out at the station, once a month, spraying for
Oh,
spiders.
Oh, yeah,
and
he
stuff.
sprays
Yeah.
for spiders.
So,
He's got a
Yeah.
four-wheeler sprayer too. where-
yeah. So, he sprays grain bins, spiders, sterilizes. So, if you put him on the deal,
Oh, yeah.
do it twice a year. he'll
Because
get
he
twice
already
a year.
comes out.
Yeah.
Yeah.
I guess the point of it is we don't mind spending some money on keeping it looking nice. We want it to look nice, so whatever we need to do that. Like Todd said, we're trying to figure something out, but if you think it would be best to have whoever's doing the courthouse do your place too,
Yeah, that'd be great.
and we can have them bid it when we figure out what we're doing.
Yep.
So, okay. That'll work. You still got some quarantine people?
Yes, poor Michelle. She got quarantined. Let's see, it was Monday, we were off. Tuesday, she said that she had a headache, so she stayed home. Wednesday, her son tested positive for COVID, and nobody's had signs or symptoms. Dwight apparently tested positive a few days ago, so she's at home,
Yeah.
but she's not showing any signs or symptoms. She's actually missing out on her opportunity to test this weekend. She was supposed to go test in Emporia for her A, and she can't because she's on quarantine.
Man.
So now she's got to wait till November
No.
to test. Yeah, But Bailey's gonna go up and test this weekend, but, you know, she's hanging in there. We call her every day and check on her, see how she's doing. We've been going to the store for them, you know, if we need to. It's hectic when everybody in their whole household is confined, so.
But she hasn't tested positive.
No, no. And then I was unmodified because my daughter Kayleen tested positive on the 4th, so I'm actually off quarantine as of today, yay. So I didn't show any signs or symptoms the whole time I was able to run. Shannon contacted me and said I need to wear a mask on patient contacts, which is what I did. Michelle will come back actually on the 19th, and she'll have to wear a mask for about a week and a half. But after that, then she's completely free to fly again. So it's been hectic because we've been down that one person. We're making phone calls trying to take transfers sometimes, and it's a mess. But we're working through it.
Well, last week when Shannon was in, and we were talking about the quarantine, and it's my understanding that if you're fully vaccinated, you don't have to quarantine at all.
Right.
Yeah,
Okay.
Yeah.
which makes 0 sense,
Right.
but that's the way the state has it laid out right now.
Yeah.
I think actually I watched the school board meeting, the St. John School Board meeting, and they're doing something about that. I think they're still gonna do some quarantining for people that are vaccinated, I think. Just because it doesn't make any sense. I think
Yeah, I think they've got to come in and do like a weekly test or daily
yeah,
test.
something like that, yeah.
So,
COVID's COVID. You can spread it whether you're vaccinated or not, as far as I'm concerned.
Yeah.
yeah,
So.
so. When, did you guys get in touch with the health department and tell them you guys had tested positive, or did they call you and tell you people around you?
Shannon actually contacted me via email after I was listed as a close contact to a positive case because we ran a call together. So, the only time I was exposed to her was in between Stafford County Hospital and St. John. So that 12-minute time frame got me, you know.
It was
But-
over 10.
Yeah, it was 2 minutes over, unfortunately,
Yeah.
but I didn't show any signs, symptoms. She told me that I was on quarantine until the 15th, so I could only go to work and home. So work and home, and that was it.
And that was because you weren't wearing your mask when you were with the patient, or were
No.
you wearing it?
I was with a positive contact. I was with a positive case,
Kayleen.
and I was exposed to her because I wasn't wearing a mask
Okay,
from Stafford County Hospital to the station. Basically,
Okay.
that was it. So,
yeah.
Okay.
but everybody's good still. So,
Good.
Thank you.
is that it?
Yeah.
Okay.
Thanks. Mr.
Whenever we have somebody come in and give us a bid,
Okay.
we'll get in touch with you and see if there's anything else out there you would like to have done.
Okay.
Yeah, we'll finish out this year, just so
Yeah.
everybody's on the same page. We're gonna finish out, I mean, there may be one more mowing or 2 more mowings, maybe, one more.
Yeah.
Okay.
I guess it just rained, so, but we're gonna finish out the way it
Maybe a
is
couple more.
now, and then for next year, we're gonna,
Yeah, I mean, maybe if you can get the Houston boy to go out there with the weed eater, knock down the weeds,
Okay.
then we'll start fresh next year.
Okay. Sounds good.
Awesome.
All right.
Thank
Thank you.
Don't you have a minute?
I have the minutes, yes. I make a motion to approve the minutes of the September 8th, 2021 meeting.
Second?
And move the second, we adopt the minutes of September 8th. All in favor, say aye.
Aye.
Motion carried. Anything else at the moment?
Do you have something, Mary?
No.
Okay.
I could do my little executive session right now if you'd like.
How long do you want? You know?
Like just 10, 15 minutes.
I make,
And
for
I want Mary to stay in and Mike.
non-elected, or, okay.
Yes.
I make a motion that we go into executive session for 15 minutes to discuss non-elected personnel, including county treasurer, clerk, county attorney, and the commissioners.
Second?
It's been moved to second, we go into executive session for non-elected personnel for 15 minutes. All in favor, say aye.
Aye.
Aye. Motion carried. Oh, I guess it's,
We're waiting on anybody else? That everybody?
I guess
That's Mike out there.
Mike's out there talking. Okay, Shannon.
So, I tried to do a quick count this morning. We're at roughly like 56 active cases in the county. I have 130 quarantine or isolation orders right now, but I honestly am not sure that I've gotten all of them typed up yet, because this week's been kind of crazy. I don't know if there's additionals from schools that I don't have typed yet either. I went and met with the school board for St. John on Monday, just to give some input for COVID restrictions in the school, and they put some good ones in place. I feel like it will be proactive and help slow things down, and that's the main reason for me wanting to get everybody together, is just I would rather have some proactive measures in place rather than have to be reactive, if at all possible. I know everybody wants to keep everybody in school. It's very important so that they're not falling behind, but we also want to keep them safe and healthy at the same time. So having some proactive things in place, I feel like would be beneficial for everybody, so.
What, I watched a little bit of your meeting, Josh, from 30,000 feet, what have you guys done? I mean, you don't have to go into every little thing, but what kind of measures have you guys taken as far as school?
Well, I guess we weren't doing things really any different than we did last spring.
Okay.
You know, we got rid of the masks in April, and so it was really surprising that it hit us this hard. And we did not start off the year with a mask mandate, and hindsight's pretty easy to look back and say it probably would have made a difference. But I can tell you our parents and our community would not have stood for a mask mandate a month ago.
Yeah.
So, you know,
Yeah.
But you can only make them wear a mask during school. Get them together after school.
correct.
So you can't say just because you had a mask mandate in school is why the outbreak is, it's come about.
Yeah, that's true.
I appreciate everybody coming and taking time out of their busy schedules, because I'm sure you're all swamped. At least on my opinion on this meeting, is kind of give clarification to where we're all on the same page, and which,
Sorry.
you can go and take that if you need to.
No.
To where we're kind of all on the same page. At least on my opinion, we're a three-man board. On my opinion, each school district has an elected school board. Each school has a superintendent and a school nurse. I know St. John and Maxville school nurses are RNs. I don't know about Maxville,
Stafford.
Stafford.
Yeah, that's okay. She is an RN
Yeah.
and she's on maternity leave, and we have a RN as a sub for her
Yeah.
right now.
So the superintendents and school nurses are in the schools every day. I'm assuming they are privy to the same information that Shannon has. And so basically between the four of them, whether it's a school nurse or Shannon, it's just interpretation of the information. But I think you guys are in the best seat to make decisions for your school. And at least as far as my opinion, the commissioners, we can work with you guys however you want, but I don't feel like it's our job to tell you guys what you need to do. So I guess if we're all in the same, if you wanted my opinion, you guys are doing a good job. Keep it up. Don't worry about us coming in and trying to overdo our responsibility.
I share that same opinion. I also wanted to just make sure that it was clear that we don't want to be overruling or stepping into what you guys know what's best for your schools with the help of Shannon and your school nurses. We're obviously here for support if you need something, but as far as new protocols, it's my opinion that nothing that we're going to do here is going to affect you guys. You guys are in charge of your schools, and we didn't want it to get down a couple months down the road and then say, we wish the county would have done something that would have affected our schools. We want the responsibility as far as any protocols or any changes to be coming from you guys instead of from us. We feel that, or at least I feel that there could be a a struggle of communication and a power struggle, not really a power struggle, but if we're making decisions here and you guys are trying to implement them, and it's just kind of a push and pull, and I think it's best if the school boards and the leadership at the schools take care of it, so. And I agree, you guys are doing a good job as far as, I don't know, is Stafford getting ready to do some testing maybe? Or Stafford's getting ready to do some testing?
We've got the kits ordered, and
Yeah.
just like Josh, our board wasn't there
Yeah,
a month ago. So
Yeah.
when we were scrambling with one case, and I don't like being reactive either, and we were reactive, and, but, you know, the rules were changing on us too, and, you know, what we can do and what, you know, what the boards, you know, they're the ones that make the decision, and we just keep telling the information, and then when you have boards that have different opinions. But at the end of the day, Monday with our situation, the board was on the same page. So it took something like that to be on the same page. So we are gonna test, but I wanna make sure that we continue the right relationship with you guys. And I think there's been some things happen with the health department, and it's like I've worked pretty hard with Shannon to have a good partnership, and something fell apart there. So I wanna get that fixed.
Mhm.
Whatever rumors are out there, or whatever I can fix.
How many kids, I know you guys are out this week, but like on Friday, how many tests were you guys doing a day?
We did 32 on Friday.
And then
That was 32 kids that were in school that day. They tested negative, that we would have had to keep at home
yeah.
in quarantine if we weren't testing.
And then his nurse helped us out till we can get ours from KDHE. And we had 13 that we felt were close contacts, and of the 13, 3 were vaccinated. And I think they tested 9 or 10 today that opted for that, and all came back negative, so.
I'd say, you know, Shannon's been great to work with on, you know, just for example, when we talked Monday night about implementing masks, one incentive we'd like to have for folks to wear the mask, because it makes a difference, and if a positive case and their close contact are both wearing masks, then there's no quarantine. So we feel that will help encourage people to wear masks.
And I reached out through email to, I have a listserv that goes out to all of the health departments in the state. I just reached out and asked who in the state had kind of implemented something like that with their schools. And I got a response from, I think, 4 different places that said that they had done that. They said that there was low transmission between 2 masked individuals with 1 testing positive. They said it helps appropriate mask use happen whenever there's masking happening within a school. And one place in particular said that if they're within closer than 3 feet, they go ahead and still have the contact quarantine, but otherwise they don't. So.
I just brought that up as an example.
Yeah.
The other night Shannon couldn't tell us that, yes, I can give you the advice that that's okay to do, because her guidance says no, but
Yeah. And
giving us the guidance, and
yeah.
the school board makes the decision, and we can all live with it.
Yes, yeah.
So that's been good to work that way.
Okay, we are not testing. We discussed this at length at the board just last Monday. Just came out of modified quarantine with the 5th and 6th grade. So, you know, our opinion is more or less that, you know, if you're going to test, okay, these kids, we could have quarantined them and they would have been in school, but it was a better option to modify quarantine, put them in a cohort group, keep them in the room. But if they're going to be exposed and you have to get tested, but they still have to wear a mask, it looks to me like it's a better option for our kids, just put them in the modified quarantine. That way they don't have to wear the mask. So, I mean, to tell our community, our kids, that we're going to go back in masks, it would not go over well. I mean, it's going to be, it's just not going to be pretty.
And I mean, I have no problem helping work with the schools on the modified quarantine thing. If that's what's working best for you guys, that is okay with me.
And Shannon has been great, because I know Shannon and Becky, if you guys don't talk every day, it's darn close to every day.
Yeah.
So they're in constant
We're at least
contact.
emailing back and forth
Yes.
almost every day, so yeah. And same with Lisa and whenever Shelley has a question, she's called too. So, I mean, everybody's in communication all the time. So we're doing our best to communicate what needs to happen in every situation that's going on. If they've got a question that they're not sure on, they get a hold of us. And we do our best to find the answer for them. So,
They were doing the best we can with a bad situation.
yeah,
I never would have dreamed it would be a lot worse
I know.
this year than it was
Yeah.
last year.
Just because it was easier when we were told what to do.
Yeah.
Because then there was no, I mean, it still created some hard feelings with families, but it's like, it's a law, you know, you have to do it. And
Yeah,
there's a lot of opinions out there right now, and that's
yeah.
playing into it, but if we can talk through it and we'll do whatever. But with our kids that were the close contacts, parents agreed to keep the masks on after they were tested today, so they're wearing their masks at school. We've left it as an option. The board just didn't feel comfortable yet making it mandated yet, so we'll see what happens after this, but.
Well, you know, it doesn't make a whole lot of sense to me that, you know, the feds tell us on like kids on a bus or a school vehicle, they're going to be in a mask as soon as they step their foot off that bus and step into the building, they can rip that thing off. So I mean, it's just kind of like, okay, we'll do it because we're told to, we have to, but, you know, I'm not out there with a close watch to make sure every single kid on that bus, you know, we furnish the mask, they're told to be wearing them, so my bus driver pays them for the drive and not monitoring masks.
Well, another thing, I just feel that there's a certain percentage of the population, and not just here, but, you know, this is a worldwide pandemic. We have not experienced a pandemic since polio. I do remember polio. I don't think anyone in this room remembers polio. And it affected the kids. And their kids were in iron lungs, and some of them were in iron lungs for a year or more. Some of them were paralyzed. Some of them didn't survive. Once we got the vaccine, once that vaccine was approved, I was reading an article the other day, that once it was approved, the church bells rang, the city sirens, there was dancing in the street, that it was approved and was available to give to children. When we got the the vaccine approved, that, oh hum, so what is it? You know, but the consequences of this disease is devastating. You know, it's evident in the mortality rates. Last year was the elderly, myself included. Now it's the kids. Why? Because the thing is mutated so rapidly that we're still in a pandemic. And I think we're going to be in a pandemic for another year or so. So this isn't going to be over come Christmas.
I agree.
But I think anything that we can do to mitigate this disease, the better off we are. And if those people who don't believe in masks, then why do they wear a mask when they handle grain? Or why do they wear a mask when they're painting their car? Or why do they... Shannon and I have a nice example. You may have already said this, but how would you feel if you went in for surgery and the whole surgical crew and the surgeon didn't wear a mask or glove? Would you be comfortable with that procedure? I wouldn't be. If I wasn't drugged up, I'd walk out. But anyway, the point is, masks do help, you know, prevent the spread of the disease. And that's my thoughts. But this is serious. This is a very serious disease.
And I mean, I know that a lot of people right now have the just thought of, oh, well, the ones that have passed away in our community are old. Well, there's still a life lost, and that's still really sad, and I don't think that they would have passed had they not gotten it. And I want everybody to take it seriously, like he was just saying, because it is serious, and I would just be completely devastated if somebody young, God forbid a child, gets it and doesn't fare well. I mean, that's part of, I would rather be proactive than reactive. If at all possible, do everything we can to keep everybody healthy. And I know there are a lot of people that don't like masks. I encounter it daily in my office because I ask everybody that comes in to wear a mask because if somebody comes in and gets one of me or my staff sick, we don't have anybody to run our office.
Yeah.
So, I mean, I want to be proactive as much as we possibly can, because the kids need to be in school and we need to keep everybody healthy. And it's not just the schools, it's in the community. And I want us to be good examples and good leaders and to do the right thing. And sometimes it's a hard decision.
And not popular.
Yes, and very unpopular.
So you're gonna start testing as soon as you get the kids? You're,
They're
you say
helping.
you're not?
Yeah.
Josh, you have been since last year.
Yeah, we're gonna continue.
Well, if you need any help, need us to do anything, let us know.
Okay.
Yep.
So
I think
now,
you guys are doing a good job.
my understanding is the hospital does have the ability to test, but it requires a physician's order or a
Correct.
healthcare mid-level.
Yes. They have to have an order to run a test there.
And we had reached out to them when we didn't have the testing yet, just we weren't there having our nurse going on maternity leave, but it's about 11:30-ish before they start, and they said it's a 70-minute wait, so.
And theirs runs a full respiratory panel too. It's not just COVID, it runs everything. So if
Oh, it's a
somebody's-
complete.
It's a complete panel.
It's a blood test.
No, it's a swab also,
Oh.
but it's a complete panel. It runs for
influenza.
COVID, flu, every single cold virus.
Oh, okay.
Yeah.
And our testing is optional, it's not mandatory. And we've had a few parents say, you know, that it could impact them financially on a few things, and we're just honoring their wishes. If they don't want to be tested, their child's just in quarantine and getting work, you know.
Okay.
Thank you guys for
Well,
your time.
thank you for
Yeah,
coming
thank
in.
you for taking the time to come in.
Thanks.
I've got one question for you.
Thank you guys.
On your quarantine orders that you send out for people that's been in close contact, one of the small businesses in St. John, their employee brought in basically a quarantine order that he needed to be off work for 14 days. But the employee had,
My letters say 10 days.
okay, I read he emailed it to me and I read it, I thought it was 14 days or 10 days after the last.
10 days after last contact, self-monitor for 14.
Okay, he's fully vaccinated? But I read through the letter and it doesn't say anything about, you know,
Because
if
they
you're
didn't
fully.
tell me they were fully vaccinated. I asked and they told me no.
Oh, okay, all right, so you asked him and he said no?
Yes.
Okay,
I ask everybody whenever I'm
Yeah.
doing the contact tracing now because of that reason, and it was, I was told no, so that's why I
Yeah.
issued a letter.
yeah,
I
because I
didn't-
think some people, no, I'm not gonna say that. Yeah.
And I know what one you're talking
Yeah.
about because we got a very nasty phone call, so.
Yeah,
Yeah,
so you
very
guys don't have
inappropriate
access
phone call.
yeah, bad.
to who's been vaccinated and who hasn't, you're just relying on?
We do, but
Yeah.
at that moment, I was the only nurse in the office.
Okay.
And I was running in and out testing, and I was trying to take care of people that were walking in for services.
Yeah, no, that's fine.
So I
just
didn't have the
Yeah.
moment to log in and do it right
Yeah.
then, so.
I figured you had a way to look, because
We do.
otherwise everybody would say, yeah, I'm vaccinated, so they didn't have to quarantine.
Yes,
Yeah.
and we do have a way to look, but the caveat to that is everybody in the state's supposed to be using it, but there are some doctor's offices that are not still. So somebody could tell me they're vaccinated and I can pull it up, and if they didn't get it with us,
Yeah,
it's not gonna be in there and I'm not gonna see it.
I mean, and you can get vaccinated at Walgreens and here
Yes.
and there, and I mean,
Yeah. So, I mean, that instance, it was I asked, I was told no, so I issued a letter.
okay. Yeah, I think that was looking for 10 days of free vacation.
That could be, but I make a point to ask people because I'm not going to quarantine somebody that is vaccinated whenever that is the KDHE guidance. I'm not going to do that.
Yep.
So,
Nope. Answer my question. Yeah, when he called me, he had the high squeaky, excited voice going.
yeah. Yes, and yeah, that day was just very crazy.
So the website you look at, is it for like the state or is it nationwide?
I look at the KDHE website, they've got all the information on there for health departments. We have update webinars every week, and if I'm able to watch those, I do. They have them on Monday and Wednesday, and then they have a partner update on Thursday mornings. So that's for doctors, hospitals, doctors' offices, health departments, anybody that provides healthcare can get on that update. So and if I can't get on those, they do send us like the slides from them or a transcription of the webinar so we can read through it to check on updates too.
So when you guys vaccinate people, do they get a card?
Mhm.
I mean, like these college kids that go out of state and the colleges are mandating it, I guess, do you have to send a letter or just they show their card that they've
We
been
give
vaccinated?
everybody a card, so we got CDC cards and we write on there what vaccine they got, the lot number and the date that they received it. They sent us tons and tons and tons of cards, so we've had people call us and say, I can't find mine, can you give me a new one? And we've given people new ones because we can pull the information, especially if we've given the dose, and make them a new card.
Okay.
So, if somebody gets one out of state and loses their card though, they're gonna have to call the state that they got vaccinated in, because I can't pull that information. I can only pull Kansas information.
So it's a manufacturer, the lot number, and the date.
And then where they received it at. Mhm. And I know that, like, airlines, especially for international travel, ask to see that. So I've just told people they need to keep it in a safe place. I don't know of anything else that you have to have that proof for, but it's the same difference. If you're flying internationally, you have to have certain vaccines for certain countries, and you have to provide that information. So I don't see it as being any different than traveling before. It's just adding a vaccine to the list.
That's all I had.
Okay.
Thank you.
Thanks, Shannon.
You're
Thanks,
welcome.
Shannon.
Have a good day.
Where'd Rob go?
Is Rob out there, Phil?
Hey, Phil.
You want to recess and talk to Phil, he probably
Well,
thinks to go.
Oh,
Or is it something, is it board wide?
no, it's not.
What do you think recess for?
We'll recess.
He probably needs. Okay. Are you sure?
What I have are some step increases for a couple of the dispatchers. Alexandra Gilkey and Nicole Petty. I didn't make copies, sorry about that, but it would be Alexandra Gilkey would be an increase from range 4, step 2 to 4 to step 3. It's like less than a 30-cent increase on that.
Has she been here, how long has she been here?
Let's see. This one here would be, Alexandria would be, this is going on her second year. And then Nicole Petty, I think it's her third, she's a step ahead of her. Range 4 still, but from step 3, because she's just a step ahead of her, she increases to step 4, I'll let you take a look at these. So. But for left at my desk, and the other one on vacation, we should have done it, but.
Are you guys full up on the dispatchers right now?
On dispatcher. We have a part-timer that we've been training to, and she's been actually helping out now since we have one on quarantine.
Who's your part-time? I'm bad with names.
Natalie.
Natalie's not.
Natalie, rather than look at.
Hoagie?
Hoagie, that's the last name. Hoagie.
Okay. Yeah,
Sure.
I don't know what the last name
Can I do these together?
is. Yep.
I don't know if I can pronounce that name.
I make a motion that we increase Alexandria Gilkey and Nicole Petty, each one step. Alexandria from range 4, step 2 to range 4, step 3, and Nicole from range 4, step 3 to range 4, step 4.
Second.
It's
It's been moved and seconded, we do a step increase for Alexandra as well as Nicole. All in favor say aye.
Aye.
Aye, motion carried.
And one other thing, we talked to you last time about the vehicle situation. We have found 2 vehicles. I've actually went ahead and placed my order on them. They're actually, I can probably pick them up fairly soon. They're Tahoes, 2021 four-wheel drive Tahoes. You can't find a pickup new. And after she said she wouldn't be doing any bids this year or for the first part of next year, I just went ahead and we got 2 of them. They're $38,000. It's a little bit more than what we've ever had to pay before. I was budgeted, I believe, $35,000
35 in general.
for it. So it's $77,696 for the 2 of them. We're getting $11,000 trade-in, but the remainder I would just go ahead, pay up to the $35,000. The remainder I'll take out of my reserve fund for those vehicles, which is over $30,000. And then to outfit them, it has gone up drastically. You used to be able to outfit a vehicle for $5,000 to $6,000. It's now $9,000 or so to get the equipment for them and outfit them in the cost. So I'll be probably taking another $18,000. I'll just take it out of my reserve fund for this one here. Be roughly right around the $50,000 mark out of my reserve fund for these 2 vehicles. That way, we're still in the process trying to hire. We did have one hired. Was supposed to start. Came in and said, his girlfriend decided she couldn't move, so he couldn't come here. So we're back to looking for another deputy position too also. So
What do you have in your reserve, do you know? I need to try to look it up.
it's
We looked.
237,000. I had written
It's a
down.
lot. It's
Do you like Tahoes better anyway than pickups? Or
Actually,
what, I mean, what do you think is,
it depends for their use. I used to have a Durango because I had a canine dog,
yeah,
but the Tahoes on the back roads are a little bit heavier. Sometimes and being four-wheel drive, they drive pretty good on the back roads that we're off of all the time and so on, but the pickups seem to blend in a little better,
yeah.
easier to get them fair. I actually don't have a preference on either one of them now. I mean, they all have their place depending on what we're gonna be doing with them.
Yeah.
Just a second, I can find that out.
The trace of that is pretty good on them though.
The Tahoes are GMC or Chevy?
They're Chevy,
Chevy.
should be a Yukon for a
Yukon.
GMC.
Yukon would be the GMC.
And we have a Yukon, right?
Yes, we do. That's
Yeah.
what we have still. That was
Yeah.
my old vehicle we turned into a
Yeah.
transport because I had third row seating in it.
Yeah,
And we still use it for transport when we have heavy duty, I mean,
yeah,
enough to haul, we bring it out for them.
yeah.
How many miles does the truck have on it that you guys are trading in?
It's actually the Explorer, and I believe it had almost 100 and some thousand miles on it, I believe. Which is normal anywhere from 100 to 120. I've even went as far as up to 135 on one, but we should have traded it 4 months ago.
Yeah.
But we couldn't get anything, so it's every month or so, it's another 5,000 miles. Every month and a half, it's 5,000 more miles, 5,000 more miles, so.
Yeah.
Do we need to do a motion or vote or anything? Because we
Yes,
already approved Rob that he could do it.
Yeah, I mean, it's,
But for the actual, the auditors would appreciate that.
Okay.
He's got 265 in his report.
that's
Okay.
kind of how it's written out. So that makes it a little easier for you to understand.
Should we go ahead and do the additional cost for the,
I had planned on taking that out of there, just so I didn't have a budgeting problem this year.
So we just need a total amount, Anita?
Yeah, that's all the
You can-
auditors will want.
so do we need to do the 77,000 plus the 18,000? And then with the trade-in and stuff, don't worry about that. 77,
And then 18,
95,
You want the exact?
yeah.
69. And then 18,
So 9,000 apiece to get them. I make a motion that we allow Rob to purchase two 2001 Tahoes and get them outfitted. The total on that will be $96,000.
second.
it's been moved and second, we authorize the sheriff to purchase 2 vehicles for $96,000. All in favor, say aye.
Aye.
Aye, motion carried. Plus or minus.
Are you done with it? I'd like to have a executive session with Rob for 15 minutes. To discuss non-elected personnel, and I'm assuming we can adjourn after that,
Yeah,
Mike, President,
including Mike, yeah.
including Mike.
For how long?
15.
15. Sounds like it'll take that.
Moved and second, we go into executive.
Sorry. I slow played you there.
For 15 minutes for non-elected personnel. All in favor, say aye.
Aye.
Aye, motion carried. Then we'll